All right, we're back with the kidney. So the first thing to point out is this structure here that's sitting superior to the kidneys. This is the suprarenal or the adrenal glands. So if we think of adrenal, hopefully that rings a bell with adrenaline. So if you think of norepinephrine and epinephrine, those are going to be produced and secreted from the adrenal gland. It's going to sit on top of the kidneys. So it's important to mention you have two kidneys, so one sits on the left and right side. A lot of times if you have like kidney infections, you get back pain because they sit back here more towards the posterior side of your body. So if you're having a kidney infection, you will experience quite a bit of back pain back there as well. So the different parts of the kidney, so we have the cortex, which is going to be this outer layer, okay? And then that's going to go into these renal columns. So that's going to be the structures in between here. Then you have the medulla. So I try to remember this as medulla middle. So it's going to be more towards the inside of the kidney. And that's going to be from the medullary pyramids and in. Medullary pyramids to the cortices. It's going to be the medulla. And it's important to specify this as the renal medulla, as there are many structures throughout the body that have the name medulla and cortex. So we have the renal cortex and the renal medulla. So these structures are going to be called the medullary pyramids, and the renal columns run in between the medullary pyramids. Okay. Then we have the renal artery, so that's the major artery supplying the kidneys. So you're gonna have two, you'll have left and right renal arteries supplying blood. And then that is going to branch to form interlobar. So interlobar arteries, and that's gonna be located in the renal sinus area. As these arteries branch into the columns, those are going to be called arcuate arteries. These have interesting names that you have to like say many times in your head to get down. So renal artery goes into interlobar, which goes into arcuate in the renal columns. And then as it gets to the renal cortex, it's going to be called interlobular. So interlobar, arcuate, interlobular. As you can see, as they branch, they're getting smaller and smaller. So here it's large, branches, it's getting smaller in diameter. And so then these interlobular arteries are going to go into afferent arterioles, and that is going to head into our nephron. I'm going to do a different video on that with the drawing of the structure of a nephron, which is the basic unit of the kidney. So that'll be in a different video, but know that the interlobular is going into afferent arterioles. Then we have the juxtamedullary and cortical nephrons. So two different types of nephrons. Juxtamedullary nephrons are going to have nephrons who go into the medullary pyramids. But cortical nephrons, the loop of Henle does not penetrate the medulla. So it's only going to stay in the cortex. So this one is penetrating, so it's going to be a juxtamedullary nephron. Okay, and then we have the renal papilla, which are at the tops of the medullary pyramids, top at being how I think of the structure of a pyramid. So not like top as of the body, but when I think of a pyramid, I think of this as like the top of the pyramid. So that's where I'm getting that from. So renal papillas are going into minor calyces. So this would be a minor calyce. And then two or more minor calyces are going to form a major calyx. And these major calyx are going to form the renal pelvis. And then that is going to drain into the ureter. And that's going to take our urine to the bladder. So ureters go from kidney to the bladder. Okay, that's it.